Hi, good afternoon, Randall.
Hey, Courtney, how are you?
I'm doing well, thank you.
Good. Can you hear me okay?
Yes, sir.
And unfortunately, you can see me too, huh?
So Randall, you have five members currently present, and so one more and you have a quorum.
Okay, thank
And
you.
Lillian just joined, so as soon as she jumps on, you have a quorum.
Thank you, sir.
Actually, before you begin, or when you do begin, would you mind taking a roll call so that we can confirm quorum? And making sure that each member we can see their face.
Sure.
Thank you.
Okay, good afternoon, everyone. Welcome to the 5-year planning committee. As we begin, I'd like to ask everyone on the committee to introduce themselves, and then we'll have our guests introduce themselves afterwards. But we need to establish that we have a quorum and get our committee noted in the record. So I'm Randall Brown, your committee chair and chair of the council. Who would like to go next?
Hi, I'm Bambi Palazola, and I am the Director of the Governor's Office of Disability Affairs.
Thank you, Bambi.
Good afternoon. My name is Stephen Nguyen, and I self-advocate from Region 10, and I am also the member at large.
Hey, I'm Lillian. I'm a self-advocate from Region 4.
I'm Mary Tarver from Region 6.
And I'm Kim Bazile, a parent from Region 3.
Okay, is that all our committee?
It shows Michelle Guillory is on, but I don't see.
I think she said that her desktop mic is not working. I believe if I read that correctly.
Or, yeah, it's not giving her a video feed option. Mm-hmm. So she, based on the council rules, she wouldn't be counted in the quorum. But
right.
Okay.
But we do have a quorum even with her absence, correct?
Correct.
Okay. And so I'll take this opportunity to ask our guests if they would like to introduce themselves.
We have a chat from Miss Ashley McReynolds. Sorry, my computer doesn't have audio or camera, but I am Ashley McReynolds, parent from Region 2. Miss
Welcome,
Kelly.
Ashley. Good afternoon.
Hi, I'm Liz Gary from Region 9, parent.
Good afternoon, Liz. Welcome.
Hi, I'm Annie Plummer from Region 9. I'm also a parent and a small business owner.
Good afternoon and welcome.
Hey, I'm Jeff Arsenault, Region 9, self-advocate, consultant. Good to be here. Thank you.
Good afternoon, Jeff, and welcome. Do we have any other guests that would like to introduce themselves before we get started with today's business?
Hi, I'm sorry, I came in late. This is Susan Reen. I'm the Director of Families Helping Families of Southwest Louisiana. Thank you.
Hi, Susan. Good afternoon. Okay.
There is a chat from Miss Michelle Guillory. I'm back on the Zoom, but it does not let me speak, and I do not have a camera on my desktop. Let's see.
Okay, well, thank you for being here, Michelle, and we appreciate it. But unfortunately, to be counted in the quorum, we'll have to be able to see you. So, but please feel free to stay connected with us. And if you can get your camera to work, we'd love to have you and you'll be counted. And if not, please just feel free to participate with the chat box feature if you'd like. And thank you to all the committee for being here today and taking the time to do this important work, and to all our guests for being here and giving us your input and feedback. We appreciate you. Having said that, let's start with today's work. Courtney, do we have the agenda we can put up for everyone to see on the screen? Okay. So we need to talk a little bit about the overview of the planning process as we begin, because today is the very beginning of a long process. And so we need to get a refresher for some of us and learn exactly what it is we'll be expected to do on this committee.
Okay. Let me work on getting that document working.
Okay.
Can everyone see the table of contents?
I can see it. Can everyone else?
Yes.
So the first 2 pages are the timeline that the council voted on and ratified back in July of last year. So if you were able to print out this attachment before today, you'd be able to see that we're actually somewhat on track with where we're supposed to be with this planning process. This, again, Chairperson Randall announced that this is the first of many meetings. There will have to be a DD network meeting after we develop initial goals and objectives from this meeting. And then there'll be another report issued. And then this committee will meet again before a final draft is presented to the council So tomorrow, before we adjourn, we will be able to schedule the next meeting or next round of meetings.
Right, and correct me if I'm wrong, Courtney, but I believe our goal here is to have our proposal to present to the full council for the October meeting. Am I right?
Correct. So it says October
So we would
2020
meet
meeting.
today and then we will meet tomorrow. And then after tomorrow's meeting, we should be able to schedule our next meeting for this committee to complete the work and then hopefully have the proposal to present to the full council for October's meeting.
Correct. So again, towards the end of August or beginning of September, this committee will meet again and review the network collaboration meeting report and just finalize the draft.
Right. And that of course means we will meet in August or September after tomorrow's meeting. Tomorrow's our important meeting as well. And then after this set of meetings today and tomorrow, then we would meet again in either August or September.
Correct. Okay.
Has everyone on the committee had a chance to read over these documents?
Good afternoon, everyone. This is Sean. So
Yes,
remind everyone the council's mandate, the DD Act indicates that councils are to engage in advocacy, capacity building, and systems change activities that promote self-determination, independence, and productivity, integration, and inclusion of people with developmental disabilities in all facets of life. And so that's accomplished. The council does a lot of advocacy. There are a lot of advocacy goals, and we have some projects such as LACAN to seek systems change by developing, improving policies and practices that affect individual developmental disabilities. There are capacity building activities that seek to enhance or increase the ability or skills of individuals and organizations. We currently have a lot of capacity building in customized employment, but we also have capacity building to build the capacity of advocates.
Sean, excuse me, but I think we just had a comment that we need you to speak a little slower so the transcriptionist can keep up.
Yes, sir.
Please, sir.
Yes, sir. Thank you for that. And finally or systems change is the transformation or significant improvement of a system achieved through policy, capacity building, innovation, and demonstration, education, and advocacy activities, which furthers the inclusion of people with developmental disabilities in all aspects of community life. So just to remind y'all that, every goal, objective, and activity that is developed through this planning process should meet the council's mandate. There are some requirements for planning. One is a goal to establish and strengthen a program for the direct funding of a state self-advocacy organization led by individuals with developmental disabilities. And so we support People First here in Louisiana. And so then the second one is support opportunities for individuals with developmental disabilities who are considered leaders, to provide leadership training to individuals with developmental disabilities who may become leaders. And third is to support and expand participation of individuals with developmental disabilities in cross-disability and cultural diverse leadership coalitions.
Ms. Kelly Monroe has her hand raised.
Yes, can you please read her comment, Courtney?
I cannot.
I believe she said that was a mistake. Thank you, Kelly.
Oh.
All right, thank you, Sean, for that information with regard to making sure our goals are in line with our mandate in this proposal process. So does anybody on the committee have anything they'd like to add? Any questions they'd like to ask?
Ms. Karanda has a question.
Yes, Karanda, please ask your question.
How will our systems change work be hindered related to the elimination of funds that occurred in the one-year planning?
That's a very good question. Sean, would you like to answer that question for her?
Sure. I mean, there were no funds that were eliminated. So I'm not exactly sure. I mean, we had interruption of activities due to, the lack of ability to do in-person activities for a while. And a lot of our activities were contingent on like partners and policymaking and some other training events. But we did not have any funding that was eliminated per se. What I did do is, and it's not for this planning cycle, for the 5 years, we're not there yet with this planning cycle because this planning cycle doesn't begin until next October. When the council considers the FY21 plan at its meeting on the 16th, there were just additional funds that I kind of rolled over to try and catch up in terms of the funding cycles of our grants. Without getting too bogged down into the weeds, I hope that helps explain that.
All right, thank you, sir. Does anyone else have any questions or comments they'd like to make? So as I said earlier, if there are no comments, okay, I believe Karanda said thank you for explaining that. As I said earlier, this is just the beginning of a long process. So we need to get a sense of what we'd like to do in relation to our upcoming plan. And probably to do that, we need to look at some of the areas of our current 5-year plan that we would expect to carry forward into the next 5-year plan. Sean, can you help enlighten us on some of the existing goals and objectives that we're currently still working toward?
Well, I think this is like looking forward. So this is actually creating new goals. I mean, y'all can look back at your old goals, certainly. This next section is just giving you guidance in terms of writing good goals. And this document comes from ITAC, which is the Information and Technical Assistance Consortium, like the federal agency that is designed to support councils. And so all of these documents here and the guidance here is what our federal partners expect the council to come up with and to meet sort of these standards, if you will, of goals. Today and tomorrow, I mean, which are really trying to develop are new goals. So it is good to look back and we can go pull up your current goals. But I think what they want y'all to understand is to write measurable goals, and they have definitions of SMART goals and how to do that. And so to make sure that a well-written goal is focused on achieving an end and an outcome that you want accomplished. And so they have a number of elements to it, to what a good goal would have. And so the first thing is to specify an expected effect, to identify the target population affected, and to set overall priorities. And so then these features of good goals, I guess, is what I'm reading in terms of additional good goals, or they have declarative statements. That's a complete sentence that describes an outcome. It doesn't have jargon. It's concise. It's easily understood. It's phrased in positive terms. So if ever you want to stop something from happening or eliminate something, I'll just use, one of the council's main objectives is inclusive practices, is community-based services, is giving people is preventing institutionalization. Well, we don't always address it we want to diminish institutionalization. We want to give people the opportunity and the resources in the community. So making it in positive terms. And then goals set up a framework so objectives can be established that gets you towards achieving that goal. And so then they have a checklist. And so what I would encourage y'all to do is, as you develop a goal, and so today, at the end of the day, you will start to develop goals. And this was designed intentionally because we're able to, and we are breaking this meeting into 2 meetings, is to go back, and we'll use the checklist on the front end, but then I would encourage y'all to go back and look at the goals that are created over time and ask yourself if it meets these features or elements. And so it's basically the questions in here are the elements I just described above. So then they actually have examples of unclear and clear goals, and good and bad goals, and to give y'all examples of, and so some of them are just too vague and not concise enough, or that they don't establish an expected effect, or and you want to make sure like a target population or a specific outcome is identified, or and it's easily understood and it's measurable. So it's and so I just want you to blow that up a little bit, Courtney. Just let everybody look at the unclear goals versus the improved goal. And so the first one is related to healthcare, and quality, affordable, accessible healthcare will be provided throughout the lifespan. Well, that's nice, but it doesn't identify a target population, and it doesn't specify an effect addressing a healthcare issue. So like an improved goal to that end would be people with developmental disabilities and their families will have increased access to healthcare services that meets their needs and preferences. Now, to that improved goal, I would actually say further guidance would be necessary to define kind of what healthcare services and what levels of access would be sought after, but it's an improved goal. And so the second unclear goal is related to education. And so it says to increase inclusive education for children K through 12 by providing information and training for parents of children K to 12, by increasing the number of parent advocates participating in IEP meetings and obtaining services. I mean, that goal sort of rambles, but it's not clear, it's not concise, and it uses jargon. And so a recommended simplification of that is people with developmental disabilities and their families will have increased information to obtain inclusive education services. I would actually say to the improved goal 2, if you went back to the checklist, I think you should look at it and ask, is it targeting a specific population? Are you going to see those specific outcomes from that goal? And so there are ways, even their improved goals, that if you evaluate, you can improve upon them further. And I think that's the design of this this technical assistance document that they provided. And they have some more additional objectives, and what's a SMART objective, and then they'll have examples of objectives that are, and SMART is not intelligent necessarily. it's actually an acronym. It's that they're specific, they have measurable statements, you know, of what they're trying to accomplish. So when you know what you're trying to achieve and you state it clearly, it's clear what the targets for progress and accountability will be. And so scroll down a little bit more, Courtney. Okay, go scroll up, just capture all the SMART elements. There you go. So the 5 elements of a SMART goal is specific is the S, measurable is the M, achievable is the A, realistic is the R, and time phase is the T. So they're all SMART. So specific is who, what, and then it's based on verbs, like something's going to be done. And the greater the specificity, the greater the measurability. And it's measurable it's focused on like how much is expected to change. Instead of just saying everybody will have increased healthcare, it's like, well, do you want to narrow that down so that you can measure specific populations or what you want to do? Achievable is a big one, because a lot of times, you know, there are huge gaps or needs and we want to accomplish everything. And so y'all are looking at a 5-year scope, which is a considerably long time. But when you look at policy change and practice change, sometimes you still have to, I guess, accept moving the needle, but not maybe filling up the entire tank in that one span of time. So making sure, you know, what your objectives are, they're achievable within the given time frame and the resources that will be attributed and given to do it. And make sure your objectives are realistic, that they accurately address the scope of the issue and they can be implemented, and it's reasonable from a programmatic and implementation standpoint. It's taking steps, and time phase is just, you know, y'all have a 5-year scope of plan. And so you might put in some objectives to accomplish in years 1, 2, and 3 that'll build, and then you can link other objectives to the 3rd and 4th years. And so some examples of that would be if, you know, you want to maybe build capacity in people's ability to maybe do support decision-making, or to, you know, we're still doing a lot of employment and customized employment. We're not there yet. And so maybe the first few years you would work on capacity building or policy changes related to that. And then the later years you would shift your focus a little bit and concentrate on fine-tuning or expanding it statewide, or if you're doing pilot projects within the state, and how to scale up different pilots. Do y'all have any questions on those things? Okay, seeing none, if you want to scroll down, Courtney. So this just, again, is just a checklist, just like they did with the goals. Y'all are not going to be doing objectives today, but you will be doing them tomorrow. But it's the same process. So, you know, as you're creating them, you know, sometimes it's better to try and get the idea out and then go back and evaluate whether it would be a SMART objective and it meets all the features, or it can be refined to be more specific, or I guess a better improved objective. And again, they have examples of non-SMART and SMART objectives down below that make sure it's specific and measurable, achievable, realistic, and time phased. And so I'll just read the SMART objective as the positive example. It's like, by year 2 of the project, The council will increase knowledge and awareness among 200 people with developmental disabilities and their families about the availability of healthcare and how to access healthcare related services and supports. And if you recall that the goal previously was about increasing knowledge and access to healthcare. Well, this is getting like the objective, like fine tuning how many people and what specifically we will help them to achieve by the end of year 2. And so it's not all done in 1 year, but it has a time frame linked to it. The council is also required to have a targeted disparity item. And that's a goal, an item in a goal or objective that addresses a targeted disparity. And this is basically populations of individuals that could be racial and ethnic minority background, disadvantaged individuals, which disadvantaged refers to income level, individuals with limited English proficiency, individuals from underserved geographic areas such as rural or urban, and specific groups of individuals within populations of individuals with developmental disabilities. Sorry if I read that too fast. I know so I'm trying to slow down. The short of it is the DD Act highlights populations from certain groups, and our federal partner, I'll say once, expects the council to target a disparity. Last plan, the target was a rural area related to employment. But you can, wait, scroll back up a little bit, Courtney, sorry. But you can see all the different population groups that are identified or specified in the DD Act. And one objective, goal and objective should have a targeted disparity addressed in it. Okay, you have any questions on that?
This is Bambi.
Does anyone have any thoughts? Anyone? Yes, Bambi.
I'm sorry, I couldn't find the button on here to raise my hand.
That's all right.
In regards to what Sean just stated, can you just state that again, Sean? Our plan has to, what does it have to do in regards to those groups, those special population groups?
Okay, scroll back up, Courtney. So a goal and objective needs to address a targeted disparity. Okay. And a targeted disparity is addressing an unserved or underserved population of people. And by population of people, it's in the middle of the screen right there. There are these, I guess, 6 major area or population groups. Although you might not think of like rural and urban as being a population group, but that's one of their definitions. And so, one thing y'all will have to do is within one of the goals and objectives, like we did it for employment in a rural area is what we tried to target this last 5-year plan, is make sure you consider targeting or addressing disparity among a targeted population. And you can do it for multiple goals and objectives. And I mean, you know what I'm saying? You're not restricted to doing it once. You have to do it once, at least once. Does that help? Does that answer your question?
Mm-hmm. Thank you.
Okay.
Do we have any comments from the committee? Questions? So today it's important that we think about some new goals that we would like to put together for our upcoming 5-year plan. And we understand that we need a targeted disparity that we need to address. And so thank you for pointing that out, Sean. So does anybody have any thoughts on what that could or should be? First of all, Sean, what is our current disparity we targeted again?
It's rural and in employment.
Rural employment.
Mhm. And so we tried to build the capacity in some rural areas in support employment was and that happened in years, I think the first, second, and maybe third year of the plan. It was not going on this year and it's not scheduled for next year. Bambi has her hand raised.
Yes, Bambi.
So in the areas of disparity, I noted when it was on the screen, they talked about maybe people living in poverty. Like I feel like that, I mean, unfortunately, we have so many people with developmental disabilities who live in poverty. So many of our goals address that indirectly, but I wouldn't count that towards necessarily. But, I think that given what we the challenges that we have faced in having racial diversity representation on our council, that it would fit into our goals of trying to include racial diversity on our council, but our outreach to me is the key component in order to get more people, racially diverse people, to become members of the council. So that would be my recommendation.
All right, thank you, Bambi. Do you have any other feedback from the committee?
Lillian has her hand raised.
Lillian?
Yeah, so I noticed in the public forum report and public input survey results, an issue that kept coming up was mental health services for individuals with developmental disabilities and the lack thereof. So maybe people with developmental disabilities who also need mental health services should be another group that we target.
Thank you.
Hey, Randall.
Yes.
This is Brenton. You have a YouTube comment from Rebecca Ellis White. Says, could there be a goal to increase the percentage of students assessed on Leap Connect who receive their services for the majority of the day, 80% or more, in general education settings? She also says the percentage increase could be decided after determining the current percentage, or the goal could be reworded to say X percentage will receive services. And that's been posted in the chat if y'all want to read it.
Thank you, Brenton, and thank you, Rebecca, for that recommendation. Courtney, are we getting these recommendations written down?
Yes, sir, I am.
Okay, thank you.
You also have a comment or question from Karanda.
Yes, could you read it, please?
Yes, Karanda said, could you strongly consider housing?
Yes, we certainly can. Thank you for that suggestion, Karanda.
In particular, affordable and accessible housing.
Correct, and good point. Thank you, sir. Anybody else have any thoughts or input they'd like to give? Any questions, comments?
Randall, if I could just share a little, y'all kind of jumped a little bit, which is okay. Y'all were, so you got some input on the targeted disparity. I mean, I don't think y'all have to decide that today. I mean, I think as y'all go through this process, is just to go back and look at those 6 population groups and make sure that in any goal and objective that y'all desire to target one of those populations, that y'all consider that, okay? Bambi had brought up the disadvantaged people living in poverty. Lillian, you brought up people with mental health issues. That's one of the other groups within population of people with DD. It's actually, just for y'all information, the definition of developmental disability as it applies to councils includes people with mental health, behavioral health issues. I note that it is often, I guess, overlooked. So I just want to commend Lillian, like it is within the scope of the council's role, but it's not one that we tend to have concentrated on as much as like people with intellectual disabilities and other developmental disabilities. That helps y'all. But y'all can go back and look at these and maybe for a number of goals and objectives. So Courtney, if you could scroll back to the areas of emphasis, which is, I'm sorry, Bambi has her hand up.
Yes, Bambi.
Yeah, I just want to correct what Sean said. I did mention the people who live in poverty, but that was the opening of me saying that unfortunately we have so many people who live in poverty. The area of emphasis that I talked about was, I think had to do with racial and ethnic minority backgrounds. That was the one that I was recommending. But I also think that Lillian, it's a great recommendation that she made.
Agreed, and thank you, Bambi.
Thanks for that clarity.
Clarification.
Yeah, I mean, and my point is like, I think as y'all go through big goals and objectives, is to go back through all these things, I guess is my suggestion. And to ask yourself if you want to like target a specific population as you move forward. So the first task y'all will be asked to do is to prioritize and I guess select which area of emphasis. And that's where y'all were jumping to with education and housing and such. And so 10 years ago, the plan included all 9 areas of emphasis. And then the federal government, our federal partners said, y'all don't have to address all 9. The council can select which 9. And it allows concentration. It also then, in some ways, when issues pop up in another area, and that's what I feel like has happened over the course of the last year or two, we did not have goal areas in every area of emphasis, sorry. So there was no place to stick an activity that some of the council members desired addressing. And I'll just take housing, for example, and so the first thing y'all will have to do is decide which of the 9, or y'all can go after all 9, but just realize if you choose all 9, it kind of spreads your resources thinner. And you just have to, or you have to combine how you accomplish or address some of them if you want to, I guess, maximize how you're accomplishing it. So, we got a lot of input, and I will say, as we go in through all that input, a lot of the areas of emphasis that have not been targeted, like transportation and housing and even recreation and health, have kind of bubbled to the surface of the feedback we've received. And so your first order, though, would be to figure out, do you want, is to prioritize these and determine whether you want to go after all 9 or whether you want to select and target some over the others. And that's a very difficult decision to make.
It's a valid point. As a committee, it is a decision we do have to make, and that is, do we feel that we need to present and try to focus equally on all 9, or do we want to specifically target a few of these important goals? They're all important, but do we want to specifically target our efforts towards a few of these goals specifically?
And y'all can further define the degree of effort when you get into the objectives and activities. So, I don't want to dissuade y'all from choosing, 9 or how many ever y'all want. I just want to make sure y'all do it with a clear understanding of I guess, how to do it and in a way that will achieve the ends that y'all desire at the end of the day.
Ms. Bambi Palazzola has her hand raised. Also, Ms. Kathleen Canino has a comment. What about
Can you
more?
read Kathleen's comment, please, Courtney, and then we'll get Bambi's comment?
Sure. What about more inclusion for children with disabilities in the community?
That's always a goal of ours, and it will remain so, Kathleen, but thank you for keeping that in our forefront in our minds during this process. Bambi, you had a comment or a question?
Yeah, so right now we're not deciding on our area of emphasis. We're going to look at the public feedback, I think, right? Is that correct?
Correct.
Okay.
But in an hour from now, you will.
Okay, that's fine.
Right.
Just want to make sure we're not doing it now. Okay.
That's right. In an hour, that's what we're going to ask. It will be the task at hand. So, and then this is the logic model. Y'all will also be asked to complete the logic model. I'll be honest, my brain doesn't think like this, so I'm probably not the best person to explain it. But basically, when you're developing a plan and you're looking at like what the impact is, and you really kind of start with what's the impact you want to accomplish, and that's what y'all are going to start. You start with the end in mind, right? And then we're asked to put in all the different inputs that we have, the activities that we'll put in action to accomplish it, the outputs from those activities, and then short-term and long-term outcomes that will move towards that accomplishing that impact that's desired. So the big impact, could be like individual DD live where and how they want to live, but all the rest of them define further activities and actions and inputs and short-term and long-term goals that will be measurable to try and determine whether we achieve that effect. Bambi has her hand raised.
Yes, Bambi.
No, that one was from before. I guess it wasn't taken down.
Sorry.
Okay.
So do you have questions on, and this will be another task. And some of it is, we'll help fill it out. But, again, I would just start with the end in mind and then figure out what inputs we have. And then how we'll look at that with long-term, short-term outcomes, and then what activities and outputs are determined necessary to achieve those. And this is how our federal partners like to see, I guess, the rationale or logic behind how you're going to accomplish what you set out in your plan. Any questions on that?
So Sean, we need to decide what impact we'd like to achieve with our goal and sort of work our way back from there, how
Yeah,
to.
that's right. And I would really just start like today, big picture. And so Courtney, if you could just pull up the agenda, is really what the objective for y'all to accomplish today is really to rank and select your areas of emphasis. If you look at the 2:45 to 3 o'clock, to establish desired outcomes and develop initial goals. And so what we're going to get to right now is let's get to all the information that has come from the public and the council and the state of the state portraits to kind of give y'all information about how people perceive their world and the data of where we are with a number of things so that y'all can get to those three big outcomes for this meeting today. Okay.
Okay. Do we have those comments from the public ready to present?
Yeah, Courtney, can you pull up like the public forum report? So we had two public forums, in February, one in Shreveport and one in Baton Rouge. Weren't a whole lot of attendance, but people in attendance. There were 7 people in Shreveport and 11 people in Baton Rouge, but I thought the information they gave was consistent with the information I've heard from, the council and some other people. And so we asked them across all areas of emphasis. We asked them these 4 big bulleted questions in the middle of the screen. What are the gaps, problems, and opportunities for improvement in the service system? What do you feel needs to change? How can the problems be fixed, improved, or made, or improvements made? What strategies can be taken to realize your proposed solution? And we start off with an overall vision. And so that's kind of interesting. Ms. Canino's comment was the first part of that vision is just be included, people, and that's the purpose of the council. So that's good. We're all on the same page. And then some was somewhat specific, but it's better pay for support staff, have a life as normal as possible, for everyone to embrace people with disabilities in the community, to increase parental involvement, need for more like inclusive early education, effective early education programs. They refer to the Goldman School, which is a school up in Shreveport area, and for deaf population and others, after school care, and be included in school at all capacities without being sent home without proper documentation or reason. But then we went to, we also looked at the vision and the gaps, problems, and all those questions I presented for each area. So, I don't know if y'all want me to go through each one. There's 7 pages of this, but I'll just hit some highlights. The vision of formal and informal community supports is for all people with disabilities to have equal opportunities as everyone else. The lack of one-stop shops at the state level to get a breakdown of service system. So that's been a common message that I've heard of a need for a consistent space, I guess, for people to go to at the state level. It came out with COVID-19, but this is all, of course, before that. And so incarceration is treatment and rehabilitation. There's not a program or services to serve people with multiple disabilities, such as mental health with autism. And so some needed changes in that category are holding everyone accountable, and presentations and education of healthcare providers, more outreach to rural areas, Um, and it's a lot of solutions were basically education based and more information. Then in healthcare, if you can scroll down, Courtney, there was a whole lot of information about gaps and lack of access of healthcare. You know, from cost in dental care to then just not having specialists like psychiatrists and neurologists available, and you know, at least not without an extensive drive, which sometimes was not realistic or reasonable for people to be able to do. A lack of nursing, and we've heard that over the last couple of years or so, and then you know, wait times. So you know, and then some of the solutions, you can scroll down, is that only just, you know, and this came out of a couple of different places, is training in post-traumatic stress disorder and trauma-informed care specific to people with developmental disabilities, and basically compliance of the non-discrimination by medical providers to accommodate people with DD. And again, the strategies were a lot of education. And then we got to housing, and it came up today already, but it's just the lack of affordable, accessible housing. And there's some solutions such as seed money for reinvestment, investment programs, and getting OCDD and our local government entities to help facilitate transitions. And then the transportation is the same thing. It's like it's the accessibility to get into the community. You know, transportation is a major barrier. Opportunities when people brought up, you know, modern transportation options like Uber and Lyft. I listened, you know, Bambi with GACTA had a great conversation on transportation a couple of weeks ago with how like Orleans Parish is looking at using some of the models from some of these private entities in public transportation. But when you get to rural areas, it's a whole different ballgame in terms of lack of accessible transportation options. And then get to recreation. You know, they do have some activities, but it's, I will say, like, and I get into this later with the, well, they, you know, these two groups were in Shreveport and Baton Rouge. So the Baton Rouge group was noted, like the Baton Rouge Recreation and Parks Department does have some activities, but they still saw the need for more inclusive opportunities for people, and a need to become more ADA compliant. And these are actually organizations that have moved the needle towards inclusion and accessibility. I will say it's, when we get to the state of the state, it's, that varies considerably from area to area. And then childcare is, the vision is all children should have the same opportunities, but the availability of childcare centers that serve children with disabilities is a gap. It's just, they're not always accessible, and certainly not in inclusive programs. So, you know, there are some solutions in terms of the Governor's Office's early child care initiative that were recommended to kind of move the needle on child care and providing stipends and funding for child care delivery. And then education and early intervention. You know, it starts off with no consequences when teachers, principals do not follow the rules or abuse students. Teachers in classroom without certification, especially departments and districts lacking control, I guess, about who's in classroom, or, you know, no protection for teachers willing to help students with disabilities. There's a long laundry list, and I'll go into the data later about what the outcomes are looking like. And so the needed changes: openness of educators to collaborate with parents, training, more policy to protect good teachers, opportunities for improvement, asking the Department of Education to train teachers and administrators on how to work with students with disabilities, and cameras to train school staff, teacher preparation programs, and they have a number of a lot of opportunities for improvement in there. I want to look at the solutions to fix, improve the system. It should be a delineation of roles, which is like a separation of roles for school resource officers, or there for school safety. I mean, there is, instead of being involved in the behavioral programming or programming of kids, and then more training, specific training on different disabilities, individualized services specific to meet the child's needs. And then employment, you know, the vision is adults with disabilities will be working in integrated and competitive employment. So the gaps is there when they leave high school, there's not always those opportunities. Louisiana leaves about $20 million on the table in VR, just because we don't put it, we don't tend to put the state match. So I'm trying to hit the highlights so I can allow y'all to ask questions. But you know, solutions again are trainings and development of business partners. That is, I guess, is indicated in our next year's plan. With working with like chambers of commerce and continuing to try and train people and customize employment. So I feel like we're a little behind and we still have a whole lot of information to cover. So that was the public forum. So I don't know if y'all want to discuss or highlight any aspects of that. We also have the survey that we're about to share.
I'm sorry, there is a comment from Ms. Tamara Crane.
Could you please read it for us, Courtney?
Sure. My agency does NEMT transportation, but Medicaid brokers keep cutting the reimbursement rate to us. I have spoken with LDH about the rate that reimbursed to the brokers versus what the providers get paid. LDH said they have no enforcement over what providers get from the brokers. This is why many transportation providers are ceasing NEMT transport. My agency has a fleet of 9 vehicles, all wheelchair accessible.
Thank you for that, Tamara, and thank you for reading that for us, Courtney. Did she indicate what her agency is, where she works? By chance?
No, sir, it's not in this chat.
Okay.
Ms. Crane, if you can hear us, if you wouldn't mind telling us.
I just unmuted. Can y'all hear me?
Yes.
Okay, so I'm the director for the Bossier Council on Aging, and we do serve all of the whole area of Bossier Parish. And there are a lot of rural. I actually just came out of the rural part of my parish today delivering meals. But we do the non-EMT, which is a lot of Medicaid. And that means children, that means adults with disabilities. And we have even worked with LRS doing transportation to job supports as one of the only providers really in our parish. But part of that is so hard because their reimbursement on the Medicaid side is going down. And the Medicaid brokers are the ones that are making this the biggest problem for us as far as the NEMT providers, because they get the money from the managed cares. And then let's just say that they get $30 for a ride, they give me 10. So they're keeping $20 for overhead. And, you know, and then if we go on a run and someone's not there or, you know, has canceled and they didn't tell us, and we say, okay, well, that was a dry run. We already sent a bus out there, a driver out there and everything. And when you're going out in the rural parts of the parish, that's a lot of time and a lot of money. And you may be doing that for one person and then they refuse to pay. And that's where a lot of transportation providers across the state are saying, I just can't keep doing it. We are going to continue. I get good support from my parish up here, but not a lot of places do. So it's hard.
Thank you. Yeah, I happen to be in your parish and y'all do great work.
Thank you.
So if y'all want to move on to, if y'all have any other questions, we'll move on to the public input survey results. So every 5 years, we send out a survey. We had 171 people who responded. 15 of those responses were self-advocates, people with developmental disabilities. 129 were parents or family members, and 27 were others, either community advocates, professional service providers, et cetera. So we did get the majority of respondents were people who were people with developmental disabilities or their family members. The demographic breakdown is we had of the 171 response, 130 were Caucasian, 8 were African American, 15 did not identify race, 3 had 2 or more races, 2 Native Americans, and 1 was Hispanic Latino. 149 of the 171 were female and 15 were male. 17 did not identify their gender. 119 were from urban areas and 52 were from rural. I mean, just looking at those demographics, I will say I think the council tends to not get adequate input reflective of people who are Black, African American, identify as African American. They just, when you look at the percentages that we also have a heavy response rate from females and lesser from males. So, so the outcomes is people were asked to rate their highest priority, and better qualified direct support professionals was number 1. Training for law enforcement first responders was number 2. Now these are not, I just tell you, when I look at rank order, it doesn't say that anything is that much greater than, but it is interesting when, as you look down the list, what people have consistently brought to the top is transition to adulthood, affordable and accessible primary and specialty health services, inclusive and appropriate education, abuse, neglect, financial exploitation. Number 7 was inclusive employment. Number 8 was positive behavioral interventions and supports. Number 9 was financial stability and asset development. And number 10 was accessible and affordable housing. And then coming in number 11 was transportation, followed by inclusive childcare. Both number 12 and 13 related to childcare options. One was inclusive childcare, one was in training in childcare, number 13. So, and number 14 was post-secondary education. Accessible buildings and programs and services came in number 15. 16 was community-based recreation leisure options. 17 was consumer rights. 18 was emergency preparedness and relief. Mind you, this was pre-COVID-19. And 19 was voting information and rights.
Miss Brenda Casse
Thank you,
has her
Sean.
hand raised.
Yes, Brenda.
Good afternoon. Can you hear me?
Yes. Good afternoon.
Yes. Good afternoon. Could we not use acronyms? And if we use them, explain them?
I'm sorry.
And also with the document that we're looking at right now, if we could somehow for the committee have the targeted disparities highlighted. And finally, the public comments that we are receiving today, would the committee be able to receive that information before tomorrow? Thank you.
Thank you, Brenda.
I mean, I can get you the chats can be made available. Like all public comments. We'll have this transcribed. I cannot guarantee I'll get that to you by tomorrow, Brenda. I will try. You know, not in written, neat form. But I apologize. I'll try and do better with not using acronyms. It's a bad habit I have. So then on the survey, people were allowed to indicate other topics, issues, or provide input. And so there were quite a few, which is, I will say we have gotten a lot of feedback over the last couple of years, which is great. And so there's this list of things that I don't think they're in any particular order. But these are other things people who respond to the survey included as important, like navigating the system, education resources on waiver and what the process is, advocating for students and educating school boards on importance of having nurses accompany children with medical needs to school, mandatory training for paraprofessionals, expansion of training for paraprofessionals. It's just policing of students, and then applied behavior analysis in schools, individual plans with a board certified behavior analyst overseeing each plan in a school, and a tech for each, that's a behavioral assistant tech for each child, and more education training for parents about special education. And this person was speaking, having a grown child. Looking back, special education was the biggest service the child got, and they did not wish they'd known more then. Training and better staffing, higher paid and less turnover, higher quality, and staffing administrative positions of agencies dealing with vocational, day habilitation, waiver services, supports and caregivers, etc. Sustainability of waiver services, slots and rates for providers, interdiction information, long-term care options, behavior supports, legislators outreach and teach, attention to deafness, high sexual abuse and DD community prevent it from happening, high advocacy skills for people leaving high school, healthy and versus unhealthy relationships. So there's a number of things, as you see, as workshops for people with individuals, intellectual and developmental disabilities to prevent sexual assault, emergency housing help for disabled, homeless, or rental assistance, transportation help, but not in city limits, no buses, need for getting to doctor appointments and food, psychiatric hospitalization for special need, people with disabilities, more residential facility options for kids and adults in various cities and state, transportation for children to therapy, video coverage of classrooms, implementation of special education, ensure equal treatment for all individuals by freedom of choice providers. That's freedom of choice providers is a list of services that are required under waiver or supposed to be available under waivers, and not all of those are available. Ensures all state agencies providing all the services that are required by federal and state laws. Provide an independent third party to which waiver recipients can turn to when they are not being provided the services required by law. require the state to reimburse waiver recipients for costs associated with obtaining services that are required by law that the state is to provide, but they're unable to provide. Mental illness for adults in our communities, and support for places that provide services for adults living with mental illness, that provide meaningful work and other things for them to do during the day to get them out of isolation. I lost my place. I'm sorry, I jumped a page. I'm on. The lack of providers who accept minimum hours that are needed. Appropriate mental health services for people. Hospitals and therapy clinics that provide occupational, behavioral, and physical therapy. Transitioning for youth after high school. More hours for caregivers and higher pay. Addressing parking space violations. COVID-19 related concerns, health direct support, community programs, etc. Better pay for direct support workers, better funding for now waiver, estate planning. Safety for people with high risk with through coronavirus, education and self-direction services, secondary education, scholarships, housing grants for people with disabilities, people with dual diagnosis with intellectual developmental disabilities and mental health issues for crisis stabilization and respite. Community supports and services, training for direct support workers in recreation and leisure activities, volunteer activities, etc. I won't repeat the ones I've said before. More support for people managing complex healthcare issues and multiple disabilities. I think that's the other ones are redundant as far as I can tell. Okay, so you get a flavor of the comments that came through. You have any comments or questions on those? Lillian has her hand raised, Randall.
Yes, Lillian.
I just wanted to echo what Mr. Sean said earlier regarding the respondents and the ratios of the respondents. I think when considering this information, it's super duper important to keep in mind that out of 171 respondents, we only got 15 self-advocates. So while I think it doesn't discredit the validity of these concerns, that it was mostly parents or family members that brought these concerns to the table, I think we should really keep in mind that this is not representative of what the self-advocates are saying, and also what the non-Caucasian people are saying, and even people who are male are saying. I mean, I just did the math, and if I'm correct, only 8.7% of the respondents were people with disabilities. So I think that's really important to keep in mind. Not saying that it, like I said, it doesn't discredit the concerns. I just think it's important to keep in mind.
Thank you, Lillian.
Bambi has her hand raised.
Yes, Bambi.
I appreciate Lillian's point, and I think that to me also goes further that we need to consider this as just another example of our outreach. So in the activities that we're going to be planning, or we just need to include how do we outreach to everyone who is not a white mother like I am. That is who we're reaching, are people like me. And we need to reach other people that are people with disabilities, or people who are non-white, or men, and get their input. And if we're not getting their input in the plans, oftentimes they might not be engaged because we're not doing activities that really speak to them or speak to their needs. And so we have to figure out how to do it. And I don't think that I'm going to figure it out, because I don't represent those populations. And so we need to bring people who represent those populations to the table and really get their input and seek it out in ways we haven't sought it maybe in the past.
Thank you both for your comments, Lillian and Bambi. I agree, outreach is extremely important, and this data shows that we need to do a better job in the future to reach out to the various parts of our community. And I think we're all committed to do our best to try to make that happen here. Anybody else have any comments or questions they'd like to add?
Okay, I think those are, I'm glad y'all looked at those demographics, because I wholeheartedly agree. So next, we would like to go into share the concepts received. These were public comments, concepts. I'll let y'all know I'm the one who submitted the first one on police tactics and treatment of people with DD. This sort of came out when with a number of incidents of the escalation of police tactics that I observed. And this is long before the revolution that I think is occurring in our country. But as it relates to people with developmental disabilities, there's a disproportionate number of people with developmental disabilities who are incarcerated, and first responders, police, are called to address people with developmental disabilities either from a victim end, or because they may be engaged in behaviors that seem odd to other people. And so there's a high incidence of contact between police and people with developmental disabilities, and they don't always end well. And the short of it, if you can scroll up a little bit, Courtney, please. I do believe there is some training necessary, but the first recommendation I have is looking at a different model of crisis intervention approach for people with significant cognitive and disabilities and communication issues. And so the first thing is to review how law enforcement practices engage people to determine what shifts are necessary when you're encountering someone with a significant cognitive disability or someone who has a communication disorder. And then have training so that I do think that there needs to be a different approach that they can shift into. And then part of that is their training, but then part of it is they need resources. So maybe someone else to contact who would be the primary person to go out on calls or to provide technical assistance during a call when they're engaged with someone who is not responding the way they think people should respond. That's the short of it. I don't have a price because I looked and there are no models that I could find across the country. I mean, there's models of training. There's a lot of training, but my concern with just doing training is the general police tactics tend to and expect compliance and people to respond in certain ways. And when that does not happen, the police's actions, which can lead to even death, are deemed justified and appropriate, and they follow the protocols that these people are trained to follow. And so I think the protocols need to change, not just the training. That's the short of that first. You jumped into the second one, Courtney, but that's the first one. The second.
Actually, we have a comment that was actually made during the last segment from Miss Crystal White, and also Miss Kim Bazille's hand is raised.
Could you please read Crystal's comment first, and Kim, you have the floor after Crystal.
So comment from Miss Crystal White. At our last meeting, we approved for LDH to create visual workflows and charts for people to see how to navigate services. Is this still in our plan? This came out as a recommendation from the Home and Community-Based Settings or Services Committee. Have we done anything differently in our outreach in recent years?
Yes, that is still in our plan, is the first one. I don't know what the outreach is referring to.
I think our question might be asking us, have we done anything differently in recent years as opposed to what we already have planned to do or already had listed? Kim, you had a question or a comment?
I do. Looking at the concepts received, I believe a concept about supported decision-making was turned in, and I don't see it listed as one of our items to discuss. Sean?
That was submitted to the one-year plan. It is being recommended for
2021 action plan.
Beginning in October, that plan. These concept proposals was received, I believe, in March. And so that's what's presented here, is the ones that we received. I'd have to go back and look at the deadline, the time frame of when we received these concept proposals by.
Thank you.
Mm-hmm. So the second proposal is by Niagara University First Responder Disability Awareness Training. David Wallen is the project director, and it's First Responder Disability Awareness Training. It lays out, it's not only law enforcement, it's also firefighters and emergency medical services, 911 telecommunicators and others. And it lays out their training program. That's a 3-year, $75,000 per year that would basically have a customized curriculum and resources to create collaboration with disability advocates and organizations and first responders, and train them in 2-day sessions on disability awareness and how to deliver the program to their agencies.
Did we have a comment or question from anyone on YouTube, Brenton or Courtney?
Yeah, this is Brenton. I just added those into the Zoom chat. One was a comment from Crystal White. She was just clarifying her outreach comment was referring to reaching other demographics. And then there was another comment from Ms. Angela Lorio. It says, as a peer support specialist certified with LDH and credentialed by LISACT, I'm not sure what that abbreviation is for. I am a volunteer presenter during the 40-hour training week. All first responders are all required to attend. These are CIT teams, and the training is already in place and can be supported by the DD Council. The training I've been involved in happens at Capital Area Human Services District and the Police Academy. The ideal is to have a peer support specialist with life experience go out with CIT teams in each call.
So to answer Crystal's question, thanks for the clarification, Crystal. I mean, we did do things differently with the survey. Unfortunately, due to COVID-19, and we used to disseminate it more broadly, but I mean, we were somewhat restricted in submitting it electronically. We did reach out to a number of organizations and ask them to push it out. And so that was consistent with what we've done in the past. But usually, you know, our push would be even to have some of our partners reach out during different outreach activities and events. And because of all those things are electronic, that was not done as much this year, I believe. So to answer your question, thanks for clarity.
And Angela, thank you for your suggestion. Well,
so the third concept proposal was related to sexual assault in the developmental disability community. And it's a multi-year proposal to provide trainings and enable people to become master trainers from Levitas. And I believe that's from Annie Comer and Jeff Arsenault, and they're online if y'all would like to speak with them directly.
Miss Brenda Case has her hand raised.
yes, Brenda.
I was just about to ask Mr. Brenton if he could ask Ms. Lorio what the acronym stood for.
Sure,
Okay.
I can ask her. She says it is Louisiana Substance Abuse Counselors and Trainers.
Thank you.
And it is a credentialing board that credentials peer support specialists.
Thank you for that information. And thank you, Brenton, for your help with that clarification.
Mm-hmm. So just to finish this concept proposal, it's a 5-year training. It would build, the first 2 years would provide 8-week courses for individual developmental disabilities using the Levitas curriculum in each of the 10 regions of the state. And then those individuals, the teachers that have been teaching these classes will become master trainers, and they would develop new master trainers from past students through the community. And so building that capacity to, I guess, so that there could be further training in years following. And it's the total cost of 5 years is estimated to be $475,000. So then the fourth concept proposal was related to employment and to build relationships with chambers of commerce in each region of the state. This, just so y'all know, that the FY21 Planning Committee that begins in October is making a recommendation to the council to do this proposal for 1 year. And this is looking at doing it across 5 years to continue to build those relationships with chambers of commerce. Across the state. And then this last one is, it's actually I'll say a number of different activities or directions related to person-centered service system and building the capacity so that the state is more person-centered in its approach. And so this whole proposal is a proposal to roll out a series of activities that would build the capacity at different levels in person-centered training and how a person-centered service system should look. And you can see, Courtney, if you scroll down, just scroll down to those. If you could rotate the page, if you right click and rotate that page for us, please. So one of them is like a leadership summit, which is a 2-day summit with key leaders to create a vision on a person-centered approach. And another one is person-centered thinking. It's a copyright training. It's a 2-day interactive training that's provided support workers and direct support professionals and providers, et cetera, teaching 10 skills that build person-centered practice capacity of agency staff. And keep scrolling down. And then the last one is training for coaches and leaders. And this is really trying to just get more organizations to become person-centered in how they deliver services. And the consultation is just, I guess, a deeper dive into the skill building of that. The charting, the life course is again, it's a trademark. It's a specific course, it's a specific product, I guess, of a company. It's just more training for individuals and families. So the target is instead of providers, et cetera, if you look at the target audience, it's more designed for family members and individuals with developmental disabilities. And then they have the Ambassadors for Respect program, which was described as a little bit different than the rest, but it's related to anti-bullying, and it's workshops on creating ambassadors in classroom settings to address bullying in schools. So, I mean, collectively, those proposals are designed to increase person-centered training approach to the service delivery system. And so they, instead of them submitting an individual concept for each one, this is from Dr. Laura Bracken and Julia Kenny, who, because usually we ask for them to submit one-pagers for each thing, and this seemed to be a more cohesive way to present those options to y'all. So if y'all have any questions, I'll try and answer them. I don't know if those individuals are online right now or not.
Do we have any questions or comments from our guests, not YouTube or Zoom chat box?
Kim has her hand raised.
Yes, Kim.
I just wanted to say, I do see some comments from the chat that y'all may want to read.
Courtney, can you please read the chat comments for us, please?
Let me see if I can find my chat box.
Fearless
I'm
one.
sharing, because I'm sharing my screen, I'm not able to see everything,
Oh, okay.
but I can find it. Hold on just a moment. Okay, let's see. Okay, from Miss Ashley McReynolds, just for clarification, supported decision-making wasn't passed before the deadline to submit. As soon as the governor signed the bill, we submitted a proposal. Let's see.
Thank you, Ashley.
Miss Lillian Dejan, I think we need to change our recipients to all panelists and attendees instead of the default all panelists so everyone can see. So yeah, it looks like there may have been an issue with the chat not being visible. I'm not exactly sure how to correct that.
It's just a matter of how people send it. If people like not Liz, like Lillian mentioned, if when you're sending a chat, you can choose either all panelists or you can send your chat to all panelists and attendees. So we will definitely do that from the staff here on out.
Thank you, Hannah, for that clarification. Liz?
Hi, Randall. Thank you. Thank you, everyone. I just had a quick question. I just want a clarification that, so are we saying that only the table of contents concepts received, those 5 are the ones that will be able to be in the 5-year plan? And I'm only asking because when asked about supported decision-making, it said it didn't make it in time. So I'm trying to get clarification as to if that's the case, because I have concerns basically because the concept may not cover everything that you hear and see over the next 5 years. So are we staying restrictive to just the concept and not allowing other things? Thank you.
Thank you. Sean, would you like to answer that?
No, I mean, this is the first meeting of a 5-year plan, the creation of a 5-year plan. You know, we had deadlines. If you go back to the time frame, the timeline to collect public input, to collect concept proposals, to collect, to do public forums. And, you know, we actually, and of course, with a lot of these activities, we have different things where we just put deadlines so we can collect them to give people the opportunity to submit them, and then things change, and y'all need to respond to those changes. I mean, I've never known this council to restrict input or consideration of things as they emerge. So I wouldn't see why y'all would start now. These were just concepts that were submitted in writing by the deadline that we put together for the committee's consideration.
Thank you, sir. And as Sean said, this is just the beginning of a very long process, and we are open to suggestions and input throughout it. Does anybody on the committee have any comments or questions thus far?
I do, Randall.
Yes, Kim.
I would like to see the supported decision-making proposal tonight. If it could be emailed to all of the committee members, and I'd like for it to be included on the table of contents.
Okay.
Thank you.
Thank you.
Bambi has her hand raised.
Yes. Bambi.
So I'm confused. Like, we aren't talking about proposals right now. That's another, like, I don't know.
Well,
maybe I'm confused, maybe other people are confused. The meeting we had like last week or week before, I'm confused my weeks, we were talking about the actual plan for Nate, like what will we be funding? What projects will we be funding? This is about what our goals are, not specific plans. We should not even be thinking, I mean, maybe in back of our minds, we should be thinking about who can do what and what kind of proposals people can submit. We kind of know who are the people that or organizations that do certain things. But this process is about developing goals and objectives, not particular projects. Is that, am I misunderstanding it, or can someone clarify that?
Yeah, no. So if I may, and it is confusing because, you know, y'all are having to develop the 1-year plan, the last year of your last 5-year plan that we're in, you know, we're about to enter into. And this is, you know, like even the goals and objectives, y'all don't have to even look at last year's goals and objectives or the current goals and objectives. It's, but to your point, Bambi, is you're right, is the concepts at this stage of the game should be very, very broad. You know, like, and I think most of them are, because until y'all have a goal and objective, having a specific activity or that directed is not necessarily appropriate. Now, supported decision making does, I guess, you know, I could see it as both, but the concept proposal that we receive, and we'll send it to y'all, but right, that's from an activity level, if you will, that where y'all really need to right now, today and tomorrow, really consider what's the overall goal of what you want to accomplish, what's the objective. That proposal would possibly fit as an activity underneath one of those things, if that helps y'all to see the structure of it.
Sean, that's helpful. I think it's confused. It was confusing for me. So I just wanted to clarify, serving on, you know, we're doing work on different committees and it gets confusing on what levels we're working at. So I appreciate it.
Kim has her hand raised. I'm not sure if it's still raised or not, Randall.
That was from before, but
Okay, Kim.
That was from before, but I will go ahead and ask this. If we're just looking at overall goals right now, then why were we given these concepts?
Because other people are confused as well. And so like, I'll just take the person-centered, you know, practices. The concept is to have a person-centered service delivery system. And then to help, I guess, people to understand how you would get there or some strategies to get there, those other things were presented. And I'll just take all of these as, you know, it's employment, you know, and connecting with chambers of commerce is really looking at employment for people. And they start going into strategies. And I think that helps to ground y'all in seeing, I guess, where it would go, where the person is seeing it would go. I feel, you know, if I were to weigh like the training for first responders, that's really activity based, but it, from a goal perspective, if y'all see the need and it is listed as a fairly high priority in the survey responses that we received, that that y'all have a goal. If y'all see the need to have a goal and objective to address that, then this would almost be a strategy to get you there. So I think that makes it more confusing for y'all to have to look at some of these things, because it's they do get very specific sometimes. But does that help you, Kim?
Not really, but
Do we have any comments from the public that need to be read?
Looks like Ms. Karanda had a question of when the deadline was. The deadline for concepts to be submitted was Friday, March 13th.
Thank you, Courtney. Are there any other comments or questions in the chat that need to be read?
No, but it looks like Ms. Caranda has her hand raised.
Rhonda, you have the floor.
Hello, how y'all doing today?
Good, thank you.
I asked a question about what was the deadline for the concepts, because if the concept deadline was March 13th, then it doesn't matter what other concept was submitted, it should not be admitted for us to actually take into consideration or look at for a first year or 1 year or a 5-year plan. That's the point of us having deadlines. So my apologies if it's gonna offend anybody, but that's the point of having rules. Our rules are, if the deadline was March 13th for things to be submitted, then March 13th has passed. It cannot be overrode or overwritten. So we just actually need to stick with the deadline and keep going forward with this meeting so that we can actually look forward to making a 5-year plan on tomorrow. But actually looking at these plans that are present, that were submitted in the time frame, is actually prudent so that we can actually look forward to anticipating making a really great 5-year plan that would impact our entire DD Council and our entire DD community.
All right, thank you. Courtney, are there any other comments?
Ms. Kelly Monroe has her hand raised.
Yes, Kelly. I think she says she can't unmute. Do I have that right?
Hey, I got it. Can y'all hear me?
Yes.
Okay, sorry. For whatever reason, it wouldn't let me unmute. So, okay, so I'm confused too. So the 5-year plan is supposed to be like general goals, and then concept papers are then submitted to fulfill those goals. Is that correct? Because I think what's confusing is what we were talking about a few minutes ago when we were looking at that page, those 5, I think there were 5 things. We kept referring to them as concepts, but those were those goals, or were those actually concepts? I think everybody's confused about this.
So the last proposal is really about a person-centered service system. If you read the proposal, and then what they provide or some mechanism, or it's like how to maybe get there, because as y'all go through this 5-year plan, you know, you will have to put the meat onto the skeleton. You're building the skeleton right now, the foundation, if you will, the house. And so maybe that's a good way of looking at it. You know, you're trying to lay out a blueprint and you want to build a foundation that you're going to then build the pieces onto. And one of the pieces that is being presented here is just making sure, you know, or suggesting as a construct or a concept for a goal or objective area to address person-centered services. Mm-hmm. And then they do provide specifics which go past that, which would be where y'all would later, if the council adopts this or whatever, then you would consider some of these other options as activities to fill in different years of the plan. Keeping in mind, the council only votes for 1 year's worth of activities at a time. So, but through the 5-year planning process, I will tell you, it's customary that y'all would plot out maybe at least the first 3 or 4 years of activities, but then each year you'd have to come back and revisit. So those activities, but so what each one of these things, these concept proposals does, it does provide the more detail in terms of the activity level rather than a construct or concept at a goal level. That help y'all?
So, yeah, I think so. So if I'm looking at this correctly, if we wanted to turn in a concept paper for supported decision-making, we would not fit into any of these categories. Is that correct?
Any which
Looking at
categories?
these categories, it doesn't look like it would fit because you have 2 for first responders and police officers. Then you have relationship training, you have employment, and then person-centered proposals. So it doesn't look like it would fit within any of these goals.
So if I may, Randall, I don't know if it's
Yes.
proper to have total exchange, but it's, what y'all need to realize is y'all are gonna create goals and objectives. And then we will again solicit concepts or proposals for activities to achieve those goals and objectives. And so your goals and objectives will not be limited. They might not even consider, they might even not include these 5 concepts that are presented here. And it will likely consider other things that are not on this, among these 5 things. So I don't think it's appropriate to think that goals and objectives will be restricted to these concepts. These are just ideas for y'all to think about in developing your goals and objectives. That's all. Does that help?
Thank you.
Okay.
Thank you.
Okay. So the next, where are we in the list of things? Are we on this state portraits? Let me go back to it. No, we're on committee recommendations. I'm sorry.
It seems like Ms. Liz Gary had a comment. It may have referred to something that was previously spoke about. Would you like for me to read the comment?
Yes, please.
It was just, so what was the point in submitting the concepts? I'm still confused.
Well, the point is to give the planning committee and the council ideas of big directions of where to go, of what to consider, what people would like them to consider in crafting the 5-year plan.
Which we are beginning to do now as a planning committee.
Mm-hmm. So Kim has her hand raised.
I see, yeah, I
Yes,
see multiple
Kim.
people with hands raised.
So why, I still don't understand, we don't need these concept papers if we have the public input surveys. Am I correct? Because we can develop our goals off of what the public gives us, not what off of 5 people presented us. Am I correct? And if we're not even looking at the concepts now, why are we talking about a deadline and a deadline that's passed and people didn't meet deadlines? I'm totally confused. And I think I'm kind of an intelligent person.
Today, our primary focus is to set the goals that for the 5-year plan, which would be the overall view of what we'd like to see done in our 5-year plan. The proposals, from what I understand, are there to give us, as a committee, some understanding of what some members of the community would like for us to consider. We have the task of deciding how we develop the goals based on all the input we received, both from that process and throughout this process as well. So nothing is decided today. In fact, we're just now beginning to decide what that 5-year plan is going to look like. And today we really need to focus on areas of emphasis that we'd like to see focused on, whether that be 9 or however many we choose. And we can begin to talk about some concepts, but we're not limited to a particular concept or idea at this point. So I guess my question to the committee, if there are no questions, is what goals? We have 9 right now, correct? Sean?
Yes, sir.
So what goals would we like to see put forth for the next 5-year plan that we're working on now? And Liz, did you have a question or a comment?
Thank you, Randall. Yeah, it was just in reference to, I'm still confused. And the only reason, and I appreciate your explanation, Randall, because it made a lot more sense. But what was confusing to me is when it was asked about the supported decision-making, it said the time had passed. And so it made it sound like there was no option but the 5 that were on the floor. And so now with all this conversation and clarification, it's clearer that those were just ideas. I just didn't know if even the people who submitted the ideas knew that that was only an idea, that wasn't even possibly something that could happen. So that's fine. I appreciate it. I got it. I understand it now. Thank you very much.
Okay, thank you. Now, for the committee, do we have any goals that we'd like to discuss? Any ideas for goals?
So this is Bambi. Are we at that point? Aren't we still going through some stuff before we get?
Yeah, you also have some stuff to go through.
Yeah, well, we
Okay.
can continue to go through stuff, but I just want the committee to be thinking about the goals, because that's the important thing we got to get done today. Is we've got to start to outline what goals we want to see in the next 5-year plan. So as a committee, I want y'all to be thinking about that as we're going through the data leading up to the process that we've got to get done today, which is trying to figure out what goals and emphasis we want to put forth by the end of today. Okay. Sean, would you like to continue, please?
Sure. So I think we're on committee recommendations at this stage. And so, and again, you know, this is part of the approved 5-year state planning development process that was approved by the council. Is council members were also asked, you know, which areas of emphasis and what, you know, concepts or implementation strategies that they wanted y'all to consider. And essentially, every area of emphasis was listed, is what my takeaway is. So, you know, and it came from different committee. Each committee, the Education Employment Committee first, would requested y'all consider including education, early intervention, employment, childcare, transportation, recreation, which is the areas under their scope. And an implementation strategy considers informing policymakers regarding the need for early intervention policies that are inclusive and meet the needs of students with disabilities, coordination with other entities regarding children issues, systems design and redesign for transportation, education, and recreation, interagency collaboration and coordination relative to transportation, barrier elimination to make programs accessible, and demonstration of new approaches to services and support related to transportation. The Self-Determination and Community Inclusion Committee recommended y'all look at quality assurance and housing. Let me pull up my document. And so on the quality assurance is to have live broadcasting participation of council members and the public. And so now we're doing that. We'll see how we can expand that after post-COVID-19, I guess. Make available a neutral party, non-staff, non-council member to assist council members with questions and procedural matters during council meetings, and replicate the Oklahoma Developmental Disabilities Council's Youth Leadership Forum program. Under housing, it was raising awareness and advocate for funding to address the housing crisis in the state. So those came out of each council committee. Yep, you want to discuss those?
Lillian, you have a question or comment?
Yes, so about the Youth Leadership Forum, I'm not gonna ramble on about it, I promise, but I do wanna mention that Youth Leadership Forum covers a lot of the issues that we've been discussing, like sexuality, employment. It does cultivate new advocates. It talks about education, transition. It educates the youth themselves. And so I think we can all recognize that it's better for people with disabilities to kind of have access to this information sooner than later. And it's really cool because it's a more proactive approach to education and creating new advocates than a reactive approach of, oh snap, people with disabilities don't have these resources. Let's just see what we can get. So I just wanted to mention that it covers a lot of the topics that we've been discussing and the problems that we're trying to solve.
Thank you. And thank you very much for your hard work on this issue. Okay, does anybody have any other questions or comments?
Okay, Rand, if I may, the last packet it's portraits of each area. So it's kind of state of the state.
Right.
And I would just like to just briefly go over it because it's 9 pages with a lot of data and information. So, you know, under the portrait of advocacy and leadership, it's the first is number A is the support state self-advocacy organization led by people with developmental disabilities. You know, previously the council had provided direct funding to support People First Louisiana. In recent years, the council has assisted with funding their biannual conference. The current activity right now is to provide technical assistance and training. And we also do a number of leadership training for individuals with developmental disabilities, including partners in policy making. We have done advocacy leadership conferences. We support council members and others in participating in different events, both in the statewide and nationally. And we collaborate with friends and families and McCann and others to provide information on advocacy. And we also support participation of individuals with developmental disabilities on boards and in other committees and commissions. And of course, we have LACAN, which supports all LACAN members in advocating. And so the state of state with community supports, and you know, we have it broken down in terms of all the data, opportunities, and system challenges. And so we have almost 13,000 people, and that was as of May 28th, who have home-based waiver services. And you can see the data on, you know, how many people on the request for services registry, but how many of those, you know, based on the system transformation, is like none of the ones with urgent emergent needs are on that list because it's prioritized. And then the third bullet indicates people receiving individual and family support services, just over 3,000, and 1,877 people receiving flexible family fund. And so then the people with developmental disabilities living in an intermediate care facility, which is a congregate setting, a group home or large setting is 3,614. Still are 12 years behind in rates for services. You know, we didn't make much progress in that this year. Opportunities, you know, there's the TEFRA program, which is Medicaid regardless of income, and that's set to be implemented in January, and the council will discuss that at its council meeting, and we'll have a presentation on that. And so I just jumped down the system challenges is insufficient funding, lack of availability of services on the freedom of choice list, you know, lack of outreach and information about available supports and services, lack of qualified providers in the workforce, availability of Medicaid in-home nursing services, lack of consistent policy and program implementation across regions. So I just, you know, if you have questions, I'd welcome any questions if I can answer them. But I mean, it's already 3:07. I'm just trying to get y'all. So early steps, early intervention, childcare. And so this is broken down to start off explaining how early steps like birth to 3 is covered through early steps, and all childcare has been morphed under the Department of Education. And so, you know, there is a separation, I guess, if you will, of the entities that oversee. The Department of Health oversees early steps, and then you move into the Department of Education's realm. About 8 years ago, the eligibility criteria for early steps became more restrictive, and initially that would result in a lot fewer children receiving services. Today, I mean, it does look like more kids have gone or getting services, but than there have been in the last 5 years. There was an increase in the number of kids getting services over time recently, which was good to see. And so it's listed here as like all the different early childhood programs, but then one of the issues is just very low salaries to pay for childcare, and that creates problems with expectations for childcare centers to make accommodations and have additional personnel to support children with higher need levels. We've seen a decrease in the percentage of children with disabilities aged 3 to 5 attending regular education programs in the last 5, and from 2012, 2017 is one of the latest data we have, and an increase in the percentage of children with disabilities 3 to 5 in separate special education classrooms and facilities. So that's, the inclusion trends are not going in the right direction. And outcome trends are not going in the right direction either. When you look at these are relative to children who without disability, same age, you know, we've decreased slightly in the positive social emotional skills of kids with disabilities, decreased acquisition and use of knowledge and skills, and decreased in the use of appropriate behaviors to meet their needs. And similar trends are found with all but one of the indicators when you factor in whether they maintained functioning. The only one that increased was acquisition and use of knowledge and skills. But so those are some relative, to me, some disturbing trends of both inclusion and outcomes of kids, young children with disabilities. When you get to portrait of education, it's we do have a positive trend of students with disabilities exiting with diplomas, and a positive trend of less students dropping out, and that's due to the April Dunn Act of 2014. So that's good news. But then again, when you look at inclusion, the percentage of children 3 to 5 in separate settings has increased. And and yet the number of the percentage of students included at least 8% of the day has decreased. And then the proficiency rates are going down. If you look at proficiency rates in English language arts and math, both of those trends are going down. When you get to discipline, all discipline data is self-reported, and you have some school districts that don't, large school districts that do not report any use of, say, restraints and seclusion, and that's not likely. The Department of Education does not maintain a model master discipline plan, although all school systems are required to have one. There is advocacy related to that from the Advisory Council on Student Behavior and Discipline. And when you get into like charter schools are required by law to serve a fair share of students with disabilities, and that is not, there's no enforcement of that. I mean, I shouldn't say they don't monitor it, because they do report it out, but there's no consequence for it. And then funding relative to that, the local funding share is distributed still on an average basis. So resources for kids with disabilities are not necessarily staying in the schools where those students are.
Ms. Crystal White had her hand raised.
Yes, Crystal.
Can you guys hear me?
Yes.
Okay. I just wanted to comment. I believe it was on Monday, the TEFRA stakeholder group met again. And I just want to clarify that I know when we advocated last year that a lot of people, a lot of parents were advocating more of a model like other states have, where if you qualify for TEFRA, you would get access to TEFRA. And that is not the plan that is being proposed to be implemented. It is going to be like a waiver, and where it's going to be capped at a certain number of slots. And I believe the slots could be anywhere from 800 to maybe 1,200. That's a rough estimate. And we know that there's going to be, at this time, thousands that would qualify for that. And there's not going to be enough slots, so therefore there's going to be another waiting list, and it's going to be a very long time for anyone who does not get in an original slot to gain access to TEFRA. So I just want to clarify that. And then the second thing is, it was also mentioned on the call that the funding for TEFRA could already be in jeopardy. It was mentioned that there needs to be, to the LDH budget, about $15 million is proposed to being reduced. And one of those things that they're looking at is TEFRA already. So I just want to let you know that TEFRA is not out of the woods. TEFRA is not like it's being implemented in other states. There's still going to be thousands of people and more being born every day who would qualify for TEFRA and still not have access to the services that they need. And my biggest concern with that program, and I'm just going to say it, is that we're going to have another waiting list of years and years and years where people and children specifically are going to pass away waiting for the services. So I just wanted to let everybody know about that. Thank you.
All right, thank you. Thank you for that update. Are there any other questions or comments that we need to read from our public?
Courtney, you want to describe the employment portrait?
All right, hopefully everyone can hear me. Okay, so I had requested some information from Louisiana Rehab Services and OCDD, since they both offer services to employ individuals with disabilities. I've provided what I could in this report. I don't want to be redundant and read the screen to you, but if you have any questions or would comment about this paper, please feel free. Can you all read the paper?
I can.
It's not completely all on my screen,
Okay.
so it's kind of cut off maybe, which might make it too small, but.
Do we have any questions or comments for Courtney on this issue of employment?
So in health, I think I'd like y'all to maybe, interested time, look at both the third bullet of opportunities and the first bullet of system challenges. Kind of, I think, points a picture of, and the first bullet under system challenges basically indicates how the U.S. Department of Health and Human Services, Health Resources and Services Administration identifies severe provider shortages in Louisiana in areas of primary, dental, and mental health care. And Louisiana consistently remains designated as a medically underserved area, especially for underserved populations, including those with the most critical needs. And that is very consistent with the messages we've received in the public forums and the surveys. And then when you go up to opportunities, which I'm not sure if it's an opportunity, I mean, I think COVID-19 really highlighted how people with developmental disabilities are more vulnerable because of comorbid conditions, and the need for increased medical and health provisions and care related specifically to COVID-19 at the currently. So, you know, again, we'll answer any questions, but I think those two are the primary messages that I've felt have been resounding in the community. And then housing, you know, there are programs such as permanent supportive housing offered through the Office of Aging and Adult Services, and there are housing choice vouchers or Section 8 and public housing through local housing authorities. There's also low income housing tax credit, which is a driver for affordable housing. So developers can get tax credits for building or rehabilitating affordable properties. There's HUD, which is I'm trying to remember what HUD stands for. I'm sorry, Brenda, I can't. I'm going to acronym it for now. It has a consolidated plan of strategy designed to help states and local jurisdictions assess their affordable housing and community development needs and market conditions. And so there are there are 5 funding sources for that consolidated plan. Those are listed here. In Louisiana, there's 169 different housing authorities. And I think that kind of, when you get to housing, recreation and transportation, I think that like the 4th bullet here is the number of different housing authorities and how many different things there are does make it difficult to do like a statewide approach to have an impact. I'm not saying it's not possible. I'm just saying it just further complicates things. And then there's just more data on there. And so the opportunities are identified as promote funding availability through government grants, low interest loans, tax credits, and start getting involved with advocating at Louisiana Housing Corporation to discuss and make the needs of the disability community known. Recreation departments are kind of local affairs. They're operated by city and parish municipalities. So there's a lot of variability in how accessible recreational opportunities are for people with developmental disabilities. There are a lot of nonprofits that have become involved in their local communities that have increased opportunities. And there are some fully inclusive recreation programs, but I wouldn't say most, but a lot of programs just tend to exclude people with disabilities. They're looking across the state. South Louisiana tends to have more opportunities for people with disabilities, both inclusive and segregated, than can be found in North Louisiana. The council has funded 3 inclusive recreation programs in the past that targeted children with behavioral issues and include positive behavioral interventions and supports model. And 2 of those programs were sustained over time with, after council funding ended. There is like the Office of Culture and Recreation and Tourism partner with Quiet Calm to so there's some state movement towards making like Capitol Park Museum accessible. And so you get into transportation. Transportation is done sort of at a regional level. They have these coordinated public transit human services transportation plans. All these links take you to all these things. And so we have linked the plans for some of those. The plans have to be developed and approved through a process that includes the participation of seniors, individuals with disabilities, et cetera, who utilize transportation services. And they should identify the transportation needs of individuals with disabilities and older adults and people with low incomes and provide strategies for meeting these needs. But again, these are regional plans, and so any tactic to address it would probably start with one of these regions, or a combination, or maybe some of the regions is in here. So if you have any questions on any of that, let me know. And so, and when I say regions, it's like multiple parishes, and then they tie into each metropolitan area and stuff. And so it's not necessarily always coordinated transportation options. And there are some other transportation, like the Councils on Aging provide some training, some transportation, and direct support professionals provide some individualized training and transportation. And then you also have people looking into things like Uber and Lyft or models such as that to as mechanisms to offer transportation. So do y'all have any questions on that?
So now we need to rank and select our areas of emphasis. Am I correct?
Yes, sir.
So these are the 9 areas of emphasis listed on your screen, or should be listed on your screen. And we need to decide if we want to focus on all 9 areas, or if there's a particular area or group of areas that we'd like to focus more attention on than the others. That's a committee decision today to make. I think we can all agree they're all equally important. It's just bear in mind if and when we do that, it does tend to have our resources more limited in how we can approach each issue and what time and resources we have to devote to each issue.
Lillian has her hand raised, Randall.
Yes, Lillian.
In regards to the area of emphasis, I think it was the public forum report that had the most respondents of family members and parents. That was really reflective that we need to prioritize education. But I think the lack of self-advocate respondents is reflective of our need to really focus on quality assurance too, and getting more programs to encourage advocacy among our people with disabilities.
I agree with you. I think it's a very valid point. Thank you for, again, making it today. Does anybody else have anything they'd like to share?
Bambi's hand is raised.
Bambi.
Yeah, so I just wanted to comment on the 2 areas, kind of reiterate what Sean said in regards to the areas of housing and transportation. We've been working on those areas for the Governor's Office of Disability Affairs and through GACTA. And those are really, those systems, because there's so many different units or entities that kind of work in silos, that it's really hard to make headway. So, I mean, I think we need to do that. I mean, to me, if you have to have housing and transportation in order to have employment or access to health care and those type of things, but it would to do it well, I think would take a lot of council staff and member time. And so we just need to consider that whenever we're making decisions on how to rank or what to include, that those areas need a lot of work.
Randall, Liz Gary has her hand raised.
Yes, Liz.
Thank you. I just wanted to add to what Lillian said as far as with the education and the concern there. I think it's also important that if you get the transition going, and when I say the transition, because during that age, it's critical, important at that point to get those youth starting to understand what self-advocacy is and how they can move forward. So I think it's critical when you incorporate what she was saying with the quality insurance and the self-advocates and the education, that all of that kind of plays in together and ensuring that you can start getting your youth at a much younger age to start as self-advocates. And so I would think that I'm just throwing my 2 cents in for that.
Thank you. I agree with you both.
I believe Miss Crystal White also has her hand raised.
Crystal?
Hey, can you hear me now, Randall?
Yes.
Okay, and I apologize. My daughter is in the car now, so I apologize for the background noise. But also on quality assurance, I just wanted to clarify a couple of things. This is also where we would put in the visual workflows and charts on how to navigate the system, correct? Is this where that would go into?
Yes, it would. They will be added. That's something we've discussed in self-determination committee, and that's something we will add in as we set the goals for this process. Yes.
I've just been hearing from a lot of the public that, that would help a lot of people through our processes are all complicated on how to apply and the steps to take and how long the process is. So to give people that visual and also, attach a timeline to it so they know, hey, to actually get services for a waiver, it's around 9 months right now. So, just to give people an idea of where they're going, it helps everyone. And I know that's been important to a lot of people. So I just wanted to make sure that those things are falling in one of these areas of emphasis. And from what I see, I guess it would fall under quality assurance.
Most likely, yes. But we will make sure that it's because it is something we've addressed, as you know, in self-determination. And we will make sure it's part of this plan as well. And thank you for bringing it to our attention. Any other questions or comments?
Randall, I do.
Yes, Kim.
I'm looking at the rankings from the people that attended the conferences. And the first one is better qualified direct support professionals. Where would that be considered on here?
Community supports.
That's what I thought.
Okay.
Thank you, Sean, for the clarification.
And then the training for the law enforcement and first responders.
I mean, I would consider that community supports too. It's different than how we typically consider community supports, but it's definitely a community support. And,
okay. All right. Thank you.
So, Raina, what I think y'all need to do is determine, sort of prioritize, rank and select areas of emphasis and see if y'all want to recommend addressing all of them, or if not, which ones do y'all recommend addressing in the plan? That's kind of the first step.
Okay.
One thing to do is maybe an individual exercise for each one of the members is just to, even if you do it mentally, just put an X into, is this more important, or less important in the scale of things? And I think that's what Kim was trying to match up, which I think is a wise thing, is looking at all the feedback and information y'all have received, which, if y'all have more questions about like which ones of these, I guess, issues fall into which area, let me know. But come up with which ones y'all would recommend pursuing, and then maybe which ones y'all would not pursue. And again, coming out of the council was a recommendation to pursue all of them, just to be clear.
Yes, I was about to bring that to their attention. The council did recommend all 9 areas for emphasis, and we have to decide today to how we want to proceed in terms of ranking. Do we want to use all 9 as council would like us to do, or given the information we received, if we change our opinion and rank some more highly for emphasis than others, given some of the information we've learned today? Or how do we want to proceed with ranking our emphasis for the next plan? Lillian, did you have a question or a comment?
Oh, I just put it in the chat. I was just correcting my previous statement about how advocacy development and specifically youth advocacy would fall under quality assurance, which I believe is incorrect. It would rather probably fall under the advocacy, leadership, and development. My bad.
It's okay, thank you. Are there any questions or comments?
Ms.
Stephen,
Carrara
you
has a
have-
comment.
I'm sorry, Karanda has a comment?
Yes, may I read her comment?
Yes, yes.
Will the DD Council consider using the survey with information provided? I'm asking because all of these issues, including the limited responses, affects the minority populations. Also, Mr. Stephen Wynn has his hand raised.
The answer to your question, Karanda, is yes. We would consider having that information available for everyone to use and partake in. Stephen, you had a question or comment?
Yeah, can I get a example of what quality assurance looks like, or?
Well, Sean, could you help us out there a little bit?
Yeah, I think what we usually put advocacy and leadership under quality assurance. And so I was actually looking at that list, and there's actually 11. I was trying to figure out how we grew 2 of them. And so usually under our definition of quality assurance is advocacy and leadership. So that's when we look at our plan. We used to use the term quality assurance and nobody understood what that meant. And so we have adopted the term advocacy and leadership as a kind of substitute for that. And it's kind of like oversight of making sure, one is building the capacity of advocacy. So that's where you have partners and your events, your advocacy conferences, and LACAN is all, and a lot of your oversight over programs and services is under quality assurance. I was trying to figure out on the list where we, oh, it was community supports. And so there's the technical thing is formal and informal community supports. I think that's the other one that was redundant on that list that y'all were looking at. So I apologize for that. So does that answer your question, Stephen?
Yes, it does.
Thank you.
Thank you.
Do we have any other questions or comments from the public?
I do, Sean. I'm going through it and I'm trying to figure everything out.
Mm-hmm.
Abuse, number 6, abuse, neglect, financial exploitation.
Mm-hmm.
Where does that fall? Which one?
Give me a second, Cam, and I'll I think I'd put that one under quality assurance as well.
Okay, what about, so number 9, would that also be quality assurance?
I've got to go open that document that you're looking at right now. The financial stability and asset development. Yeah, it could also be, yeah, I guess it wouldn't be community supports. I guess, yeah, I guess I would roll that one into that one as well. You know, as a best fit.
For community supports, but we're going to keep number 6 at quality assurance. Okay. Okay, I think that's all. Thanks.
Okay.
Thank you. Do we have any other questions or comments from the public?
Hey, Randall.
Yes, Brent.
It looks like Crystal White has a comment that she posted in the chat. It says, how many total areas of emphasis should there be, or how many have there been in the past?
Currently, we have 9, and we are trying to determine today whether we should continue to have the 9 or should we focus our emphasis on less than 9. Recognizing that every area is important, but as you focus your energy, if you have more areas of emphasis, you typically have less resources to devote to each than you might if you concentrate on particular ones. But currently there are 9, and we are discussing how many we should have for the next plan now.
Crystal White has her hand raised.
Yes, Crystal.
Do we know how many we had areas of do we know how many areas of emphasis we had in our previous 5-year plan? Just to get an idea of where we generally are with how many areas we tend to try to focus on. And then also, it might be beneficial if before this is ranked, if just for clarification, each one examples that we've all been going through kind of go through quality assurance, what all lumps under there, and to each one of them. so that way people can have a clear understanding of what they feel is most important and how to rank. That's just a suggestion. Thank you.
Thank you.
So the ones that we do not have in the current plan, it might be an easier way to look at it. We do not have a specific goal on health, housing, transportation, or recreation. So we have 5. And I asked Courtney. Courtney is cleaning up this list. So currently we address 5, but when you look at the goals, we kind of y'all have merged like education, early intervention, childcare, all under, saying together. Y'all don't separate it out. You have a separate goal for employment. You have a separate goal for advocacy, leadership, development. We do not have any goals or objectives or activities targeting health, housing, transportation, and recreation. So those 4 areas, I think community supports is addressed in a lot of the advocacy efforts of the council and those activity levels. So it's, does that help answer your question and give y'all a better understanding? Kim has her hand raised, Randall.
Yes, Kim.
Okay, I think what Crystal said, and I'm going to reiterate, is can we take the top 19 from that page and put them under each one where they go? Just so we can see. And if there's any way that could be emailed to us tonight and we can have a little homework, and then we can start tomorrow morning or tomorrow at 1 o'clock with our rankings. Is that a possibility?
Sure. Yeah.
Yes. Do we have a comment from the public?
Yeah, Kathy Dwyer has her hand raised.
Yes, Kathy, you have the floor.
Hi, can you hear me?
Yes.
How is everyone?
Good, thank you.
When y'all were going through those categories of the emphasis, Sean mentioning about the ones that did not have any priorities, do you need a priority for the health category? Because I'd be happy to suggest one.
We'd be happy to hear your suggestion.
I'm on the OCDD dental task force for adults with developmental disabilities who have difficulty with receiving dental services because of aversion to people probing in their mouths. And we have discovered that there's quite a few families who are not able to get dental services for that population because no one is willing to work with that population or has the expertise or equipment like anesthesia or whatever. The only places are typically like University Hospital, and tends to be very expensive, something that Medicaid doesn't typically cover. So we've been trying to work on coming up with the plan and recommendations to give to OCDD to start addressing it. And it certainly would be helpful if we had the DD Council's backing on that.
Thank you for bringing your efforts to our attention today. And thank you for your work on that task
You're welcome.
force.
One thing I'd like to add is that dental health is important to overall health. Poor dental health can lead to coronary problems and other problems, severe infections, including, sepsis and so on and so forth. So it's critical that this population gets the services they need.
Thank you for bringing that to our attention.
You're welcome.
Now to the issue of homework, is everyone on the committee agreeable to have a homework tonight as far as ranking these priorities?
I'm good with it as long as, and I hate to put Courtney, I'm assuming you're the one that's going to have to do it on the spot to get us an email tonight. Can you do it?
It would be my pleasure.
Thanks, Courtney.
Thank you very much, Courtney.
Also, just to clarify, am I also submitting the supported decision-making and adding that to the concepts received? I just want to make sure I do what I need to do.
If it's not too much work, could you do it?
No, sir. Again, I just needed to make sure that that was still needed for me to do. Also, Ms. Brenda Casse has her hand raised.
Yes, Brenda. Brenda, you have the floor.
My apologies. What we're doing for homework right now is what I alluded to earlier. And could we also include the targeted disparities? You could put TD next to it. Thank you.
Thank you.
I'm sorry, can somebody repeat, or Brenda, can you repeat what you said to include? I had trouble hearing.
She wants to include the targeted disparity and be able to put TD next to it to indicate the targeted disparity we'd like to highlight.
May I ask a point of clarification?
Yes.
Okay. So the targeted disparities, that is something that this committee is supposed to select. So I don't feel comfortable with sending out something and me selecting what targeted disparities or highlighting targeted disparities. I would prefer this committee decide the targeted disparities, please.
Is that something we're comfortable deciding on tomorrow, or do we need to decide on that today? And I'm asking the committee.
I think we have to wait till tomorrow because we don't know yet. We don't have enough
Right.
information.
That's my thinking as well, is once we get a sense of what our rankings are, then we can begin to discuss what the targeted disparity should be. But Brenda, you have a comment?
Thank you for that clarification. 1 second.
So am I to highlight everyone, all of the ones listed, and designate that as a potential targeted disparity? Yes. Okay. Thank you, Ms.
Yes.
Brenda. Thank you.
Thank you.
Lillian has a comment.
Lillian?
Oh, I just put it in the chat. It was in reference to the email, the original email that was supposed to be sent out about putting the respondent suggestions under the areas of emphasis. It was just reminding everyone to keep in mind that people with disabilities only make up like 8.7% of the total respondents, I believe, in the public input summary.
Okay. Thank you.
It looks like Miss Brenda has her hand raised again.
Brenda, you have the floor.
Thank you for clarifying that again, the proper wording of what I'm trying to emphasize. Having served on first-year planning committees and 5-year planning committees in the past for the council in particular, some of these things, I just recall in the past, they were already highlighted, they were already numbered, they were already labeled, so to speak. And we already knew which public comment, which public report, public survey, all of those numbers Mr. Fleming read. That's what I was asking. And everybody's kind of asking also what Ms. Basile in particular, she's saying, which one does this fit under? Which one does that fit under? So in the future, if we could have the information that we already have, which is the public reports and the public comments, if we could have that in the documents in advance, I think it would expedite this process. Thank you.
Thank you. Your suggestion is noted. Do we have any other questions or comments?
There's a comment from Karanda.
Yes, could you please read that comment for us, Hannah?
Sure. She said, are we, in all caps, considering the access to proper health care for minorities with developmental disabilities in urban and rural areas to be placed under the health option as a suggestion?
We certainly do see that as a priority and take your suggestion at this time. Do we have any other comments or questions or suggestions?
We have a comment from Kathy Dwyer.
Could you please read it?
Sure.
Thank you, Hannah.
Having general dental care for adults covered under Medicaid is also needed in, I'm thinking that might be addition. Okay, that's what I thought. Sorry, I'll reread it. Having general dental care for adults covered under Medicaid is also needed in addition to adults having aversions and needing anesthesia for an exam, cleaning, and x-rays.
Thank you, Kathy. Okay, so Sean, do we have any other business we need to do today before we adjourn?
Well, I mean, I guess if y'all still on selection of areas of emphasis, it wouldn't be appropriate, I guess, to go into try and do outcomes and goals. So, right, I wouldn't advise y'all, if y'all haven't done that, I guess I wouldn't advise going further at this point.
Right, I'm thinking that since we have agreed to rank our emphasis and get our minds wrapped around it, I think the first thing we should tackle probably tomorrow should be the setting of the goals and emphasis.
Mm-hmm. Okay, I agree. So we'll get you all that information as soon as we can. I'd already actually sent Courtney a list. The other thing about the list from the survey, there's 19 items. There's a whole, there's pages, there's like 5 pages of 4 additional pages of issues that people brought up that fall under all these different categories, these different areas of emphasis. for y'all to consider. But I mean, we'll take the ones that are ranked and we have them in with their rank orders listed under their respective areas of emphasis. And we'll send that to y'all in the other documents y'all requested. Okay. Brenda has her hand raised, Randall.
Yes, Brenda.
Yes, thank you. The ones that are already ranked by the public.
Yes. Do you have a question or a comment further? Sean, you're going to include all the rankings from the public or the rankings we already have listed?
Yes, sir. I'm sorry. I didn't know y'all were waiting for me to. Yeah, that's my intent. I mean, I can show them to you real quickly. Let me blow this up a little bit. You know, the only one is, and so these are each one of those 19 under each one of the areas of emphasis. Drop down another page. The only thing is positive behavioral interventions and supports. I am going to put it under 2. I have it highlighted here because people want behavior in schools is always an issue. And then, I mean, the council has actually funded a project on positive behavioral interventions and supports in the community for direct support workers and stuff. So I do have that one listed under 2 areas of emphasis. But I mean, this is how I've just quickly broke them out. I don't think there would be much change to this list. If I just wanted to see, I'll try and put it all on one page for y'all to make it easier to process. So those were the 19 areas of emphasis. Yeah, I can still see that. The rankings of all the items. I mean, again, I'll just, I guess, share that, you know, the fact that say like housing is number 10 and only has 1 item doesn't detract from how critically important it is for people to have housing, you know, and how important that item is over maybe, you know, an area that might have 5 things or 4 things. But anyway, so we'll put this together with some other things that y'all requested, and y'all.
Thank you, sir.
Please let us know.
I appreciate your work. I appreciate the staff's work.
Whatever is sent to y'all, if y'all want more, just let us know. We'll send it so y'all can start off tomorrow with all the information y'all need.
Thank you, sir. Does anybody have anything else to add?
I move that we adjourn this meeting.
Do I have a second to Kim's motion for adjournment?
I'll second.
Do I have any objections to the adjournment? Any abstentions? Hearing none, today's meeting is adjourned. Thank you all for your participation. Thank you to our stakeholders and public members for your comments and suggestions. And we'll see you all tomorrow at 1 p.m. Enjoy your homework.